Hi, I'm Dr. Thomas Ogie from Ogie Chiropractic in Kewaskum, and today I'm going to show you a video on how I adjust this young man here. This is my grandpa Chuck, and he's 91 years old, and I just want to go over how light and easy an adjustment can be for people who require the light, easy adjustments. So right now, I'm adjusting Charlie here. I'm stretching him out a little bit. Charlie typically has a lot of low back discomfort, and this typically feels pretty good for him. So I just move him around a bit, stretch him out, loosen him up. This is really good for people with disc issues, just general mechanical low back pain, as well as any kind of radiculopathy, which means pain radiating down the back of the legs, the front of the legs, stuff of that nature. This is a very gentle technique. Just slowly work them around, up and down, left to right. Start by loosening up the soft tissues in the back, and then I would work a little bit deeper and get into the individual vertebrae and work them out a bit. Just gotta loosen things out a bit here. Like I said, this is a very gentle technique, and usually it feels pretty darn good if you have a tight low back. Feeling good there, Charlie?
Feeling wonderful.
And now we're just working Charlie's upper back here. He's got a couple tight knots in there. Just gonna work them out a little bit. Feels like you've been sitting around with your back hunched over a little bit there, Charlie.
Yeah, right.
Got some good spots there.
Mm-hmm.
Motion into those segments there. Just work a little bit with the range of motion on some of the stuck joints we feel. And he does have a little bit of a stuck spot right in here. Just going to give his spot a little bit of a pop here. Now at his age at 91, most spots in his spine are going to be a little bit stuck, but doesn't have to mean they have to be completely stuck, so there, and that feels alright, right?
Mm-hmm.
Alright. And that concludes our video. If you have got low back pain and have never considered chiropractic, why don't you give our office a call? We could get you in today.